Hello and welcome. Today we're diving into a relatively rare, but serious condition affecting the urinary system, ureteral avulsion. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the outlook is for those affected. Let's get started. Ureteral avulsion at its core is the tearing or ripping away of the ureter, the tube that carries urine from the kidney to the bladder from its point of attachment. This can occur at the kidney, the bladder, or anywhere along its length. The most common cause is blunt trauma, such as a car accident or a significant fall. Penetrating trauma, like a gunshot or stab wound, can also lead to ureteral avulsion, although less frequently. Iatrogenic injury, meaning injury caused by medical intervention, is another potential cause, particularly during complex surgical procedures involving the abdomen or pelvis. Occasionally, severe pelvic fractures can also result in ureteral avulsion. The pathophysiology of ureteral avulsion is quite straightforward, yet devastating. When the ureter is torn or separated, the normal flow of urine is disrupted. This leads to extravasation, meaning urine leaks out of the urinary tract and into the surrounding tissues. This extravasation can trigger an inflammatory response and, if left untreated, can lead to significant complications such as urinoma formation, a collection of urine outside the urinary tract infection, and even kidney damage. The severity of the consequences depends on the location and extent of the avulsion, as well as the time elapsed before diagnosis and treatment. Epidemiologically, ureteral avulsion is considered a rare injury. The exact incidence is difficult to determine, as many cases may go initially unrecognized or be masked by other more obvious injuries in the context of major trauma. It's more commonly seen in the setting of high-energy trauma, meaning significant forces are involved, which often translates to motor vehicle accidents being a primary risk factor. It's important to note that children are particularly vulnerable to ureteral avulsions due to their smaller size and more flexible skeletal structures. Iatrogenic injuries, while a cause, represent a smaller proportion of total cases. The signs and symptoms of ureteral avulsion can be subtle or dramatic, depending on the severity and associated injuries. Common symptoms include flank pain, meaning pain in the side or back, abdominal pain, and hematuria, or blood in the urine. However, the presence of other injuries may overshadow these symptoms, making diagnosis challenging. In some cases, there may be no obvious external signs of trauma. Later signs, if the injury is missed, can include fever, signs of infection, and a palpable abdominal mass representing a urinoma. It's crucial to maintain a high index of suspicion in patients with relevant trauma mechanisms. Diagnosing ureteral avulsion requires a thorough evaluation, often involving imaging studies. A CT scan with intravenous contrast is typically the gold standard. The contrast allows visualization of the urinary tract and helps identify areas of extravasation or disruption. A retrograde pyelogram, where contrast is injected directly into the ureter, can also be used, particularly if a CT scan is inconclusive or contraindicated. In some cases, ultrasound may be used as an initial screening tool, but it's less sensitive than CT for detecting ureteral injuries. The key is to have a high index of suspicion in patients at risk and to utilize appropriate imaging modalities promptly. Ureteral avulsions are generally classified based on the location and extent of the injury. They can be categorized as proximal, mid, or distal, referring to their location along the ureter, near the kidney, in the middle, or near the bladder, respectively. Additionally, they can be classified as partial or complete, depending on whether the ureter is only partially torn or completely severed. This classification helps guide the surgical approach and treatment planning. The treatment and management of ureteral avulsion depends on the severity and location of the injury, as well as the overall condition of the patient. The primary goal is to restore urinary drainage and prevent complications. Minor partial avulsions may be managed conservatively with placement of a ureteral stent to allow healing. However, most cases require surgical intervention. Surgical options include ureteral reimplantation, where the ureter is reattached to the bladder, ureterotomy, where the two ends of the ureter are reconnected, or in severe cases, a more complex reconstructive procedure such as a Bori flap or ileal interposition, which involves using a segment of the bladder or small intestine to bridge the gap in the ureter. Early surgical intervention is crucial for optimal outcomes. Preventing ureteral avulsion is primarily focused on preventing the traumatic events that cause them. This includes promoting safe driving habits, such as avoiding drunk driving and distracted driving, and adhering to workplace safety regulations. In the context of surgical procedures, meticulous surgical technique and careful dissection can help minimize the risk of iatrogenic ureteral injuries. Recognizing high-risk situations and taking appropriate precautions are essential for minimizing the occurrence of this potentially devastating injury. The prognosis for ureteral avulsion depends on several factors, including the promptness of diagnosis, the severity of the injury, and the presence of other associated injuries. With timely and appropriate treatment, most patients can achieve good long-term outcomes with preserved kidney function. However, delayed diagnosis or inadequate treatment can lead to complications such as stricture formation, kidney damage, and even kidney loss. Recent research has focused on improving surgical techniques for ureteral reconstruction and developing less invasive methods for managing ureteral injuries. Further research is needed to optimize treatment strategies and improve patient outcomes. Thank you for watching. We hope this has helped you understand more about ureteral avulsion.